Why only 10 payments have been made after 3.5 million people applied for the 350 rand special COVID-19 grant. SASSA says it was actually a test run and that recipients who don't have bank accounts will be able to get their grants via their cell phone numbers, provided they are RICA'd in their names. There are concerns of fraud in proper checks if proper checks aren't conducted.
We did a test last week. We paid about 10 people as a test to make sure that the system works. Now we know the system works. That's why we've now sent the details to all the people that were ready to pay so that they can load their bank accounts and we can pay them immediately. Those people that have received the message that says, please go to this link and give us your bank account. If they've applied this month, they will get 700 rand next month. In terms of people that don't have bank accounts, as long as they have a cell phone that is RICA'd, we're going to pay them on their mobile. They will get an e-money.
Well, for reaction on this story, we're now joined on the line by Black Sash National Director Lynette Maart. Only 10 payments have been made after 3.5 million people applied for the 350 rand special COVID-19 grant. What's the Black Sash's response to this?
Well, she did say that it was a test run, so let's put that one first. What she did not say was how many people will be paid in May. And the minister was very clear in her various speeches that by 15 May, people will receive the COVID grant. Now, from that 3.5 million people that registered, the CEO of SASSA, or SASSA spokespeople, also said that many of those were duplicates. So we don't really have the correct figure of the actual applicants. What we do also know is that there are 15 million people who can potentially benefit from this. 7 of the 15 million have been taken care through the caregivers grant. So that leaves us with 8 million people. So let's just get the context right. So given that, and I mean, let's just try and anticipate. I'm not quite sure that SASSA will probably reach 100,000 this month of that total figure. So it is a bit disappointing. But one also needs to understand that I think that there were unrealistic targets and deadlines that were set. So you need to set up the system. You need to make sure that everything is verified properly, that fraud, that the potential or the exposure of risk to fraud is being dealt with properly. SASSA itself at the moment is operating at a third of its capacity. It doesn't necessarily have the capacity at the moment to deal with those people who have no devices, data, or interconnectivity. That piece still needs to be rolled out. So there's still lots to do on the application front, and there's still lots to do on the issue of processing the applications. And then I think that what's encouraging of what the CEO has said is that there will be back pay. And I hope that kind of back pay is a norm, will become the norm, because there are many people that are standing in the queue still to be registered. And the regulations were very clear that it's budget-related payments, and secondly, that there will not be this back pay element. So it's encouraging to hear that people will be back paid. But we might sit with a humanitarian crisis again, in that because people have not been registered or are waiting to be registered, the few that will go through will get their money. But the others who are still in the queue will have issues with food and just basic humanitarian issues, and there doesn't seem to be a clear strategy around that.
If I hear you clearly, Lynette, you reckon that it was to be expected that there would be these kind of teething problems, even with about 3 weeks since the announcement that people would be getting these social relief measures?
Well, let's. I mean, at the moment, there's most of the application tools are electronic or technical tools. There's no face-to-face tool. That piece must still be rolled out, and it will be rolled out in June. And then, if one look at the devices, that how many poor people actually have a smartphone or a laptop, or data is another issue, and then interconnectivity. So I think those who could apply through those means people also have to apply through proxies. So if you don't have the device, you can go to somebody who can assist you to apply. There's other risks in that. And then there's people who also don't have IDs. There's people who don't have bank accounts. The CEO also said that they will roll out the e-wallet or whatever cash transfer mechanism to mobile phones. I think the problem has also been here about the communication. The communication has only been up to date around the application process itself, but not about what are the feedback loop in terms of, have my application been successful? When will I receive my money? How will I receive my money? It's good to speak on these platforms about these, but for that information to go to the ground level is another issue in the vernacular of local people, that they can understand what they must be expecting.
Tell us about the work that Black Sash has been doing during this lockdown period in terms of your observation of human rights abuses and the kind of protocols that are being put in place. Are you happy with that?
Well, we've been focusing on two issues in the main. The one is we've always worked in the area of social assistance. People, in short, call it the grant system, and payments of the grants under lockdown. We've monitored those. At the beginning, there were these very long queues with no social distancing, no proper sanitizing, etc., etc. Some of those issues have kicked in. We've also observed very, very long queues. SASSA has made an adjustment to say that, look, let's stagger these payments. So there's a staggering process going on now, and shifting that outside of the monthly payments so that grant beneficiaries don't have to stand in very, very long queues. We've been also monitoring the social relief of distress elements. We think that that's part of the essential services. Just like grant payments is part of the essential services, the social relief of distress elements under this pandemic is also an essential part of the relief efforts. And so we are tracking and keeping track of the process of the COVID-19 social relief of distress grant. The other area where we've also been tracking and monitoring, and people calling our helpline for food parcels, that they can't get their grants. There were issues around particularly the disabled who were unable to access grants. Some of those have been addressed through regulations that payment will continue until October. But there's still people that need to access that grant, and so mechanisms need to be in place. So our work has really been trying to focus on one or two areas and do that particularly well, and provide good feedback to SASSA and to civil society organizations and the public around those particular issues.
Let me just ask you, in terms of the regulations again and the protocols that have been put up during the lockdown period, which ones for you stand out as ones that we need to keep going forward?
Well, let me just ask one other answer one other question, and that is, one of the issues in the regulation is the issues around operating hours of SASSA. And that's been quite a contentious issue. And the contentious issue is that the officers were operating on a third of the capacity. SASSA is trying to address that by opening up all the offices. Some people have slept on the streets to ensure that they have a place in the queue, because sometimes the officers only take about 70 to 80 people per day to deal with grant-related issues. So that's one area that needs to be looked at, is the nature of SASSA's essential services that it's supplying, and then the full opening of these offices with a full complement. The other thing that we think needs to be taken forward is the COVID-19 social relief of distress is a very important grant for or a form of social assistance for those between the ages of 18 to 59 who have no income. COVID has just elevated or brought that to the surface a little bit more when we saw these long queues of people who were standing in food lines because their money's run out, the precarious existence or livelihoods that many people pursue. And so this COVID grant should actually become a permanent feature of the South African social assistance landscape. It's an essential part of our social relief, but also social assistance component. And for many years, the government has not addressed that. And we hope, that it will be addressed going forward.
Thank you so much for talking to us this morning, Lynette.
Thank you for the opportunity.
Lynette Maart is a National Director at Black Sash. Now, South Africans with compromised immune systems are likely to be at risk of worse outcomes should they become infected with COVID-19. Getting tested for HIV for those who do not know their HIV status is key to surviving the coronavirus. For more on this, we're joined via Skype by